Cancer is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. 2.8. These contrast with benign tumors, which do not spread. 8. Possible signs and symptoms include a lump, abnormal bleeding, prolonged cough, unexplained weight loss, and a change in bowel movements. 1. While these symptoms may indicate cancer, they can also have other causes. 1. Over 100 types of cancers affect humans. 8. Tobacco use is the cause of about 22% of cancer deaths. 2. Another 10% are due to obesity, poor diet, lack of physical activity or excessive drinking of alcohol. 2, 9, 10. Other factors include certain infections, exposure to ionizing radiation and environmental pollutants. 3. In the developing world, 15% of cancers are due to infections such as Helicobacter pylori, hepatitis B, hepatitis C, human papillomavirus infection, Epstein-Barr virus and human immunodeficiency virus, HIV. 2. These factors act, at least partly, by changing the genes of a cell. 11. Typically, many genetic changes are required before cancer develops. 11. Approximately 5 to 10% of cancers are due to inherited genetic defects from a person's parents. 12. Cancer can be detected by certain signs and symptoms or screening tests. 2. It is then typically further investigated by medical imaging and confirmed by biopsy. 13. Many cancers can be prevented by not smoking, maintaining a healthy weight, not drinking too much alcohol, eating plenty of vegetables, fruits and whole grains, vaccination against certain infectious diseases, not eating too much processed and red meat and avoiding too much sunlight exposure. 14-15. Early detection through screening is useful for cervical and colorectal cancer. 16. The benefits of screening in breast cancer are controversial. 16-17. Cancer is often treated with some combination of radiation therapy, surgery, chemotherapy and targeted therapy. 2-4. Pain and symptom management are an important part of care. 2. Palliative care is particularly important in people with advanced disease. 2. The chance of survival depends on the type of cancer and extent of disease at the start of treatment. 11. In children under 15 at diagnosis, the 5-year survival rate in the developed world is on average 80%. 18. For cancer in the United States, the average 5-year survival rate is 66%. 5. In 2015, about 90.5 million people had cancer. 6. About 14.1 million new cases occur a year, not including skin cancer other than melanoma. 11. It caused about 8.8 million deaths, 15.7% of deaths. 7. The most common types of cancer in males are lung cancer, prostate cancer, colorectal cancer and stomach cancer. 19. In females, the most common types are breast cancer, colorectal cancer, lung cancer and cervical cancer. 11. If skin cancer other than melanoma were included in total new cancer cases each year, it would account for around 40% of cases. 2021, in children, acute lymphoblastic leukemia and brain tumors are most common, except in Africa where non-Hodgkin lymphoma occurs more often. 18. In 2012, about 165,000 children under 15 years of age were diagnosed with cancer. 19. The risk of cancer increases significantly with age, and many cancers occur more commonly in developed countries. 11. Rates are increasing as more people live to an old age and as lifestyle changes occur in the developing world. 22. The financial costs of cancer were estimated at $1.16 trillion USD per year as of 2010. 23.
Cancer is a group of diseases that involve abnormal increases in the number of cells, with the potential to invade or spread to other parts of the body. 1. Not all tumors or lumps are cancerous. Benign tumors are not classified as being cancer because they do not spread to other parts of the body. 1. There are over 100 different known cancers that affect humans. 1. Cancers are often described by the body part that they originated in. However, some body parts contain multiple types of tissue, so for greater precision, cancers are additionally classified by the type of cell that the tumor cells originated from. These types include carcinoma, cancers derived from epithelial cells. This group includes many of the most common cancers, particularly in older adults. Nearly all cancers developing in the breast, prostate, lung, pancreas, and colon are carcinomas. Sarcoma, cancers arising from connective tissue, that is bone, cartilage, fat, nerve, each of which develop from cells originating in mesenchymal cells outside the bone marrow. Lymphoma and leukemia. These two classes of cancer arise from cells that make blood. Leukemia is the most common type of cancer in children, accounting for about 30%. However, far more adults develop lymphoma and leukemia. Germ cell tumor, cancers derived from pluripotent cells, most often presenting in the testicle or the ovary, seminoma and dysgeminoma, respectively. Blastoma, cancers derived from immature precursor cells or embryonic tissue. Blastomas are more common in children than in older adults. Cancers are usually named using carcinoma, sarcoma or blastoma as a suffix, with the Latin or Greek word for the organ or tissue of origin as the root. For example, cancers of the liver parenchyma arising from malignant epithelial cells is called hepatocarcinoma, while a malignancy arising from primitive liver precursor cells is called a hepatoblastoma, and a cancer arising from fat cells is called a liposarcoma. For some common cancers, the English organ name is used. For example, the most common type of breast cancer is called ductal carcinoma of the breast. Here, the adjective ductal refers to the appearance of the cancer under the microscope, which suggests that it has originated in the milk ducts. Citation needed. Benign tumors, which are not cancers, are usually named using oma as a suffix with the organ name as the root. For example, a benign tumor of smooth muscle cells is called a lymphoma. The common name of this frequently occurring benign tumor in the uterus is fibroid. Confusingly, some types of cancer use the noma suffix, examples including melanoma and seminoma. 3-4. Some types of cancer are named for the size and shape of the cells under a microscope, such as giant cell carcinoma, spindle cell carcinoma, and small cell carcinoma. Citation needed. Contents: 1. Bone and muscle sarcoma. 2. Brain and nervous system. 3. Breast. 4. Endocrine system. 5. Eye. 6. Gastrointestinal. 7. Genitourinary and gynecologic. 8. Head and neck. 9. Hematopoietic. 10. Skin. 11. Thoracic and respiratory. 12. HIV/AIDS related.